Welcome to our Healthy Smiles class. Thank you for being here. My name is Erica. I am with the School and Community Oral Health Program. Our program works at 95 schools in Multnomah County, where we apply dental sealants for kids in 2nd, 3rd, 6th, and 7th grade. We also have a baby day program at 4 of our Multnomah County clinics, where we see babies for dental checkups from when they have one first teeth until they turn 3 years old. We also work with the WIC program, where we do this class in person at 3 different locations. In this class, we're going to cover some tips and tricks to help you and your family have a healthy teeth and mouth. Some things you have heard before, and some it will just be a review. So let's begin. You know that our teeth are very important. They help us eat a lot of the things we eat. They help us talk and feel good about how our face looks. Oral health is important, but what makes a healthy mouth? In a healthy mouth, tissues are moist, odor-free, and pain-free. When we talk about a healthy mouth, we are not just talking about the teeth, but also the gingival tissue or gums and the supporting bone, known together as the periodontium. In this picture, we can see what all is involved in just one tooth. It's just a lot more than the small part we see, and why it can be so dangerous and painful to let a cavity grow all the way to the root. A healthy mouth has no untreated decay and no evidence of lumps, ulcers, or unusual color on or under the tongue, cheeks, or gums. Teeth should not be wiggly, but firmly attached to the gums and bone, at least it's a baby teeth. It should not hurt to chew or brush your teeth. Why a healthy mouth and well-functioning teeth are so important? Because we really need them for like eating. Teeth help you bite, tear, crush, and grind food before swallowing it. Speaking, teeth help you form sounds and speak clearly. Smiling, teeth are an important part of your smile, which can influence how others perceive you and how you perceive yourself. Digestive system, teeth are an essential part of your digestive system. Face shape, teeth give your face the shape and help you look good. Emotional well-being. Oral health can affect your emotional well-being. Heart health. If a lot of bacteria live in the mouth, it can make their way into the bloodstream and increase your odds of having a stroke or a heart attack. A tooth infection can cause this too. What should you eat to have a healthy mouth? Eating foods high in calcium and other nutrients, such as cheese, milk, plain yogurt, calcium, fortified tofu, leafy greens, and almonds. Protein-rich foods like meat, poultry, fish, milk, and eggs that are a great source of phosphorus. Fruits and vegetables are also a good choice since they are high in water and fiber. These foods also help stimulate saliva, which helps to wash away acids and food from teeth, both blocking acid and protecting teeth from decay. Many fruits and vegetables also have vitamins like vitamin C, which is important for healthy gums and healing. Vitamin A, another key nutrient in building tooth enamel. Things to do to prevent cavities. Brush twice a day with fluoride toothpaste. Floss once a day. Visit your dentist regularly for cleanings and checkups. Eat a healthy diet and limit sugary drinks and snacks. Consider dental sealants for added protection. Let's review something else that prevents cavities: fluoride and dental sealants. Fluoride strengthens the tooth enamel and reduces the risk of cavities. Dental sealants are protective coatings that are applied to the chewing surfaces of the back molars. They prevent the accumulation of bacteria and food particles in the crevices of the teeth. Sealants are safe, effective, and long-lasting. What else can we do to maintain a good oral hygiene? Do not use any tobacco products. If you smoke, seek resources to help you quit. Limit alcoholic drinks. Some alcoholic beverages can be very acidic, resulting in erosion of the tooth enamel, and those with a high alcohol content can lead to dry mouth. Also be mindful of drink mixers, many of which are high in sugar and can increase the risk of tooth decay. If your medication causes dry mouth, discuss other medication options with your doctor that may not cause this condition. If your dry mouth cannot be avoided, drink plenty of water and chew sugarless gum. Chew sugar-free xylitol gum between meals and when you are unable to brush after a meal. Replace toothbrushes every 3 months and keep them 3 feet away from the toilets. Taking care of your baby's teeth is important too. Baby teeth are just as important as permanent teeth. Sometimes we think because they will fall out that they don't matter, but they do. Baby teeth are important because they help children eat and grow. They make the shape of the jaws and face. They help them speak. They keep the space full when the permanent teeth come in, and they help them have a healthy smile. Having good oral hygiene for your babies. Begin brushing when first tooth appears. Talk to your dentist or doctor about putting fluoride varnish as soon as one teeth appears. Wipe gums with towel after feeding. Model brushing habits. See a dentist by the time they get their first tooth. Do not give soda and dilute juice. When teeth are touching, start flossing. Give water in between meals. Read books to them about oral health. Be creative. Make it a fun experience. When your child turns 1, wean them off the bottle, but do not stop breastfeeding. This is a baby teeth eruption chart. You can see that they all come at different ages, and it takes about 3 years to grow all 20 teeth. In the order they came, they will be falling out as well. If you're able to have these 20 teeth fall out without any cavities, it will be a great success, so try it. In this other chart, you see that the first permanent molar comes in between 6 and 7 years old. This is the time to consider putting sealants. You can see in the picture how it looks before we put a sealant and how it looks after. The permanent molar has a lot of crevices and holes where germs can hide and create cavities. The only way to prevent that is getting a sealant. That way, we cover all the hiding places. So remember, when your child is between the ages of 6 and 7, ask your dentist about sealants. How do cavities form? We all have bacteria in our mouths, and when we eat, especially sugars, they feed off of that. That creates an acid that will affect the healthy tooth. It is a good idea to drink water after drinking or eating sugary or acidic foods. This is the stages of tooth decay. It starts with a white spot along the gum line that can turn brown until it decays the whole tooth. The habit of lifting their lip. To check for these spots, lift the lip regularly. If you see white spots, you can still reverse it. Call your dentist and do a better job brushing and using fluoride. If you see brown spots, they are already cavities and they will just keep growing. Call your dentist to make an urgent appointment. So lift their lip regularly because it is better to catch them when they are still just white spots. Battle tooth decay often occurs in the upper front teeth, but other teeth might also be affected. Formula, juice, milk, weaken the tooth enamel. To prevent battle tooth decay, don't put them to sleep with a bottle. Use a blanket or stuffed animal instead. Create a structured meal and snack time where they can have juice or milk. Wipe your baby's mouth with a moist cloth before bed and when they wake up. Drink water in between meals. Make toothbrushing at home fun. Don't share your own cavity bacteria with your child by sharing eating utensils, blowing on food, chewing baby's food, cleaning their pacifier, and kissing them on the mouth. Because yes, you can pass on a cavity to your child. Another good idea to take care of your cavities right away. How much sugar should we have? If you can see in this picture, the American Heart Association recommends consuming no more than 6 teaspoons a day of sugar for women and children, and no more than 9 spoons for men. And most of the drinks we see here go over the limit. So it is a good idea to be aware of how much sugar our drinks have and maybe limit what we have each day. And yes, it can be hard. To conclude, I want to leave you with some reminders. Remember, baby teeth are very important and we have to take care of them. Preventing cavities will save you pain and money. Check your baby's teeth for spots frequently. Take care of your cavities so you don't pass them to your baby. Limit the sugars that you and your baby drink. And remember, you are an example. How you care for your teeth is a very important example for your child. Often many people wait until it's too late to get dental care, so you can be a great example for your child by taking good care of your own teeth. Here is some information about our dental visits for your babies that we have. Before the age 2, you can participate in Baby Day program. Baby Day is a program where children 6 months to 3 years old receive dental care in a friendly, positive environment. We provide dental care at 7 clinics in Multnomah County. We see patients on the Oregon Health Plan who have Care Oregon. We also see uninsured patients for urgent care. First appointments and uninsured patients, call 503-988-6942, or you can call 503-988-3905. Returning patients should call their clinics directly. Thank you for your participation.